Maintaining the dental bridge you have is crucial for its durability and function. If you've just received an implant or been using one for some time, it is essential to take care of your bridge to avoid any problems or issues. In this short video, we'll go over various ways to maintain your bridge's dental health effectively. 1. Regular brushing and flossing. Like the natural teeth of your mouth, the dental bridge also requires regular flossing and brushing in order to maintain its cleanliness and avoid any accumulation of food particles or plaque. Make use of a soft bristled brush as well as non-abrasive toothpaste to clean your bridge like your own normal teeth. Flossing can also be important to keep your teeth clean between your teeth as well as under the bridge in order to avoid dental decay or gum disease. 2. Use a water flosser. Alongside regular flossing, using water flossers can help in cleaning difficult-to-access places around your bridge. The water flosser makes use of water streams to eliminate plaque and other debris from the area between your teeth as well as around your bridge. It provides an even more thorough cleaning as compared to traditional flossing only. 3. Avoid hard foods. In order to avoid any harm to the dental bridge, it's important to stay clear of eating hard food items like ice, nuts, or hard candy, as well as popcorn kernels. They can cause too much pressure on your bridge, which could result in it cracking or loosen. Choose foods that are soft or chop harder food into smaller, easier to manage pieces that will protect the dental bridge. 4. Avoid sticky foods. Similar to sticky food items such as taffy, caramel, or chewing gum must be avoided since they could be stuck between teeth and bridge and cause plaque to build up and the possibility of decay. Choose healthier snacks which are easy to wash off the bridge in order to keep it clean and healthy. 5. Regular dental checkups. It is crucial to see your dentist on a regular basis for routine examinations and cleanings in order to maintain the bridge on your teeth and general oral overall health. The dentist will assess the health of your bridge, scrub off any plaque buildup, and deal with any problems prior to them becoming more serious. The dentist may recommend modifications or repairs to your bridge if necessary. 6. Use a mouthguard. When you are prone to grinding your teeth during the late at night or engage in contact sports, the mouthguard will help safeguard the bridge of your teeth from harm. The grinding process can place unnecessary stress on the bridge, which can lead to wear and tear with time. In addition, injuries from sports could cause the bridge to be loosened or removed. Custom-designed mouthguards can offer additional security for your bridge when you are sleeping or engage in games. 7. Watch for signs of problems. It is crucial to stay conscious of any indications of problems regarding your bridge like sensitivity, pain and swelling, or even loss of tension. If you notice one of these signs, it is essential to consult your dentist right away to get an assessment and treatment. In the event of ignoring potential issues, it could result in more serious problems later on and could require more intensive treatments to fix the problem. If you follow these guidelines and tips for taking care of your bridge dental, you will be able to ensure the longevity of your bridge and its functionality over the years. Be sure to maintain good dental hygiene, keep up with regular dental exams, as well as be aware of the foods you consume to safeguard the bridge on your teeth and ensure that your smile stays healthy and gorgeous.